It is a new year, but COVID-19, it is also still very prevalent in our community. In today's To Your Wellbeing, what the numbers look like as we start this new year, what to expect in the coming weeks and in the months ahead. Right now with us is Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. She's joining us. So first and foremost, let's just go right to those numbers. What do the numbers look like?
So, as we anticipated, we knew that our numbers for the state continued to trend up. And I believe just on January 2nd, we had over 9,000 cases being positive. I know today's a little bit less. However, these represent probably closer to, we mentioned about 16 to 18% being positive of all the tests that are being done, which to me mentions that there's still far more people who have it that we've yet to test. And in terms of our own hospital system here at Cone Health, we have now about 264 patients with COVID who are hospitalized overnight. And that is a lot of our, and do we have capacity for more? We do. However, based on our projections for the month, we'll come to a point where it just feels like we do have a shortage and of beds available.
265. How does that compare so that people kind of have some context to what it used to be or where we started out or where the mid part was?
Sure. So, when in the beginning of December, we barely just hit 200. And to us, that was a very big deal. We at our main COVID hospital, the census there is 100. And then a lot of the other patients get placed at our other hospitals in different counties. And what we've noticed is that, we're not this standalone island, so if another hospital system is unable to accept patients, we'll accept some. And then we'll know certain rates are higher for instance, in Alamance County, or maybe they're a little bit, we see more patients with COVID who are in our Reidsville campus. And so it's impacting like all our campuses. And with that, I think the thing that's also challenging is that, we have plenty of other patients that have other health concerns seeking medical care. So our emergency rooms are very busy, and, and we're really trying to work so that patients do not stay in the emergency too long who would otherwise require to be admitted. We've worked out different models to try to help discharge people who can receive some of their care at home. So we have this care like hospital to home model for COVID patients. And then also people who are newly diagnosed with COVID who may have worsening risk of outcomes. We have established this infusion clinic to receive monoclonal antibodies. So we've created like these other aspects to help, however.
To help with the beds that you're seeing kind of diminish. So again, you said 200 at the beginning of December, 265 now.
Correct.
Where do you see that count going?
So unfortunately, it's accelerating. So our estimates is that it could be close to 400 by the end of this month. So in 3 weeks time.
400.
Right.
Double what it was at the beginning of December.
Correct.
Okay. With those kinds of numbers, you are, like you said, you're trying to alleviate the need for beds. So you're doing kind of like a teledoc or virtual doctor appointments for some folks who don't have symptoms that are as bad.
Correct. Or we're actually trying to provide other therapies for them. So we've noticed that we've been able to give this monoclonal antibody infusion, and in certain groups it prevents hospitalization. So we've been able to increase the capacity of doing that. And then some of our patients that are hospitalized and need to finish up their therapy of antiviral therapy, like getting remdesivir, we also are able to provide that to them on an outpatient basis.
Okay, so we're talking about different kinds of therapies to, get people better, but of course, what everybody's looking at, for the saving grace of all of it is the vaccine. So where are we with the vaccine?
That's a great question. So I know, as soon as the vaccines had rolled out nationwide, statewide, everybody, at least in healthcare, was, this is that glimmer of hope that we need. And next is the next caveat to this is that hurdle of how do you vaccinate a large portion of your community as quickly as you can. So right now we are in the phase 1A, which is vaccinating healthcare workers that work with COVID patients. And then we are about to launch the 1B phase, which is including patients who are folks who are older than 75 years old will be eligible to get the vaccine. So we are working, I know a couple health departments have already started to implement that in the state of North Carolina. We are close to being able to expand that to our residents in our community. So more information will be coming out in this week.
And I know you say close. Any kind of like estimates?
So, definitely
have a good reality.
next week for sure, and possibly Saturday.
For the information on when that could happen.
Oh, no. So the information will come out this week. So over the next coming days. But the intent is starting our vaccine clinics for folks who are older than 75 on Monday.
Okay, that is really good news. I mean, and we know lots of people who are saying, when am I getting that vaccine? So at least we know that that's starting. Okay, so then the next, question is, once we think that we're getting this vaccine in place, this, that, and the other, right? How long are we dealing with this whole COVID-19 thing?
It is definitely going to be here this year. Given what we know about the constraints of how much vaccines we have and how we would like to vaccinate the majority of the population, we know that the vaccine plan at least takes us easily through the summer, and when you have this novel virus in a community, it usually lingers for a couple of years. Does it mean that we are still in the midst of always wearing a mask? For now, yes. For now, do we still need to be very cognizant of where we go and making sure we're not in these close groups? For sure. As we have better herd immunity, which means people who have immunity by vaccination or having had COVID and now are immune, we want that percentage to be high in order to have enough protection for those that are unable to be vaccinated. So that process of getting herd immunity close to like 75 or 80% takes a very long time. What I envision is that, right now we have to do as much as we can in observing those 3 W's and really buckling down. We really need to do as much as we can in order to, save anybody from getting the COVID and needing to be hospitalized. I think all this help, like my healthcare system, as well as our neighboring healthcare systems, are all feeling the brunt of this.
Yep, that was going to be my next question. What do we all need to do? And you said, do what we have been doing and continue to do it and do it to the fullest extent. Okay, so what we're going to do now is we're going to open things up to your questions. And this is how we do it. You text us your question. The number is 336-379-5775, and we'll be right back.